test track in the Midwest. It's used by Detroit to torture new vehicles, to test their limits. As part of its quest for FDA approval, Laser Vision Centers has come to this facility to put the mobileexcimer through its paces. On board, a Vizx Star laser. Engineers from Vizx, Calumet Coach, and Laser Vision Centers. The mobileexcimer is fitted with accelerometers and other sophisticated devices which record every bump, each torturous vibration that is being inflicted on the laser protected inside. The mobileexcimer is forced to simulate virtually any type of road condition, from high-speed turns, panic stops, potholes, uneven pavement, speed bumps, even the cobblestone streets that might be encountered in Europe. After each stop, the unit is parked, set up, and the laser is activated and tested. In spite of the abuse that was heaped upon the mobileexcimer, abuse that would never purposely be encountered, the engineers concluded that the laser was not damaged, and in each instance, the laser remained fully calibrated and ready to use. These tests, along with other scientific data, were submitted to the FDA in support of Laser Vision's PMA supplement application. On April 7th, Laser Vision was notified its application was approved, making Laser Vision Centers the only company in the world with an approved mobile laser system. The excitement that surrounds the excimer laser, anxious patients, concerned relatives, ophthalmic technicians busy preparing for surgery, while surgeons double-check data points. This could be a scene from any surgical facility. But it's April 14th, 1997. The place Minneapolis, for the first time in America, patients will be treated on the mobileexcimer. Dr. Richard Lindstrom, Laser Vision's medical director, and his colleague, Dr. David Harden, will have the honor of performing the first cases.
Well, it's a lot of fun for me to have had the opportunity to do these first cases on the now FDA-approved Laser Vision Center's mobile excimer laser system. We've actually been looking forward to this day for several years. And what it really means is that it's a whole new era now for laser refractive surgery. We now will be able to access the smaller community and provide the same quality of care that you can achieve at a large institution such as the Philips Eye Institute.
The mobileexcimer has many of the same features and amenities found in the typical surgery center. The laser suite is spacious and well appointed. The suite is positively pressurized, humidity controlled, equipped with a triple redundant power supply system, an ADA-approved wheelchair lift, a corneal topography unit. Everything that is needed to perform excimer laser surgery.
Well, the mobile excimer laser really is a very comfortable environment for the surgeon. Actually, today, before I did these first eyes on the mobile unit, I operated all day in the Philips Eye Institute, and I've been there for a year now with the Vizx Star laser. I'm very comfortable with it, and we walked out into the mobile unit, and I really couldn't tell any difference. The environment's comfortable, the air exchange is high, so the quality of the environment is good. The sterility is good. The environment seems to be very comfortable for the patient. So to me, there's really no difference between this and the Philips Eye. The availability of the machinery, the format of the room was quite acceptable for the treatment of LASIK, and in fact just the same as it would be in a fixed site system. And actually the room is nice and large and is larger than many operating rooms in a refractive surgery center. The setup really is the same whether you're doing PRK or LASIK. From the surgeon's perspective, there really isn't any difference. You're basically set up exactly the same. At least for me, I have an assistant to my left, and I have a circulating assistant as well, and we really couldn't tell any difference as far as the procedure from a step-to-step basis. The patients that we treated today here in the mobile excimer laser system tolerated the procedure extremely well, and from the surgeon's standpoint, there's no difference than doing it in a fixed site in an operating room where you might be used to doing whatever other procedures. Patients like the convenience of having the mobile laser system available to them, and the patients really tolerated the procedure well and didn't find any difference as far as they could tell from a fixed site system. Well, we actually were a little concerned about that even today, because we had patients that were scheduled for our fixed site laser, and we basically told them the exact truth, that the laser had just been approved for mobile use, that I was the medical director of Laser Vision Centers, that we had access to the mobile laser, and did they have any problem having a surgery done in the mobile unit. And we didn't really find any resistance to that at all. So I don't think there will be much resistance. I think that people will be very comfortable with the environment as far as the patient perspective, and clearly from the surgeon perspective, I don't see any problem whatsoever.
After years of testing in America, Canada, and Europe, the mobile excimer is available in America. The mobile excimer will bring laser access to cities and towns of all sizes. Now, many surgeons who must drive long distances to access the laser will be able to work at home. Many surgeons plan to employ the mobile excimer to project their practice presence to areas served by optometric networks.
I think this is exciting technology, and what we're going to be able to do now is to take it all over the country, and I think that's really exciting for patients and for surgeons, especially in those areas where they don't have the capability to have a fixed site system because of the volume. So in the smaller communities, the ophthalmologists will be able to treat their patients in their own hometown, which I think is just very exciting for the patients.
Well, most people that live in rural communities are used to mobile units, and for example, I do cataract surgery at some satellites, and one of them that's in Mora, Minnesota, every time I go there, there are one or more mobile units there. The last time I was there was a mobile MRI unit, a mobile lithotripsor, and a mobile mammary radiography unit. And so on that given day, they were taking care of patients in that community. Those three mobile units, plus the mobile unit that we utilize to bring advanced cataract equipment there. And if you add one more for refractive surgery, the bottom line is the patients in the rural communities are very comfortable with this concept. And it turns out that not every small hospital and every small community can afford every expensive piece of equipment like an excimer laser, but they would still rather have it come to them with their local surgeon and their local environment than to have to travel hundreds of miles to have it done. So I really think that we're going to find a large interest in this, and probably a lot of surgeons that are currently traveling to fixed site centers will stop and start to do it in their own local communities.
The mobile excimer is now available. If you are an experienced refractive surgeon, or if you are just making the move into laser refractive surgery, Laser Vision Centers has programs to help train you and your staff. Laser Vision can help create a marketing plan and show you proven strategies to develop a strong patient base. And Laser Vision can help you make the transition to LASIK.
Now, currently, Laser Vision Centers has some protocols for performing LASIK, which is, like we've talked about, is an off-label use of the excimer lasers, combining the microkeratome with the use of the excimer laser for faster visual recovery than we see with surface PRK. The use of that investigational protocol, which is currently monitored by an investigational review board in Minneapolis, Minnesota, called the Alina IRB, is available for surgeons across the country that do special training in LASIK, that are trained in the use of the machinery and also the use of the investigational protocol. And this will apply to those
surgeons that are performing in a transportable mode the LASIK procedure.
I think FDA approval is important, and that's really why we spent the time and money at Laser Vision Centers to achieve FDA approval. And I think it's going to make the surgeon more confident. I think it's going to make the patient more confident. We have the data to show that the patient can get the same result in a mobile laser unit as they can in a fixed site center. And I think that'll be very reassuring both to surgeons and to patients.
I thought the whole idea of making a mobile excimer center was kind of foolish, taking a big complex piece of equipment and putting it in on wheels. The idea seemed to me to be strange. I must say I changed my mind about 1.5 years ago when I first saw this unit under development, and when you walk outside it looks like a truck, inside it looks just like a regular operating room. In fact, it's larger than many regular operating facilities I've seen.